Hello. Thank you for joining us today. I am Joseph Glazer, Deputy Commissioner of the Westchester County Department of Community Mental Health. The purpose that we have come together for this is to train individuals and help them understand how the service system in Westchester County works to assist those with behavioral health needs. Unfortunately, our service system in this nation, state, and county are very disjointed. And part of the goal of this is to bring all of the service providers together and help them understand how our various service systems work. Individuals with behavioral health needs have very few singular needs. What I mean by that is that people have multiple needs. So as we go through these trainings, we will work with you to help you understand how our service system works, how you help people get benefits, how you help people get housing, how you help people get connected with the services that they need, whether they're mental health needs, substance use needs, developmental or intellectual disability needs, all of the things that we know people need to improve their lives and to move forward on the road to recovery. We have broken this program up into 3 separate units. The first one is really an explanation of the services that are available. The second one is how we access the benefits that will help cover the cost and pay for the expenses of providing these services. The third one is a very important one as well. It is how you, as a healthcare provider working in the community, can keep yourself safe. We thank you again for joining us, and I look forward to working with you as we go forward to make our world a better place for the people we serve. Thank you. Good morning. Thank you for joining us for our second session here as we provide training to community providers, case managers, case workers, and others who are serving individuals with behavioral health needs. Today's focus is going to be specifically on the subject of accessing benefits for the people you work with. You will hear today from Christopher John, who will talk about the SOAR program, and Ashley Brody, who is the Executive Director of Search for Change, who will walk you through the benefit system. Both of these areas are very important because it is through accessing benefits that the multitude of services that are available in the community can be paid for people who are working in the public health care and public mental health and behavioral health systems. So we thank Chris and Ashley for joining us and look forward to the information we're going to share and your feedback. Thank you.
Good morning, everyone. As DC Joseph Glazer said, my name is Chris John, and I'm the program coordinator with the Department of Community Mental Health, but I'm also the local lead for SOAR in Westchester County. The purpose of us coming here to you today is to share a number of things as it relates to this program. One thing is that we want to share the importance of SSI and SSDI, SSI being Supplemental Security Income, and SSDI meaning Social Security Disability Income, and the benefits that have for people living with homelessness or experiencing homelessness, and also potentially at risk of homelessness as well. Some of the major benefits of SOAR, which stands for SSI, SSDI, Outreach, Access, and Recovery, is that it provides support for income, health insurance, it supports education and employment supports, as well as housing stability. We also want to offer you the ability to become a part of SOAR. SOAR is a great training for case managers and anybody in the community that helps you to fully understand what Social Security is, the benefits that comes along with it, but also how you can help navigate the complex system of Social Security to better support people who are experiencing homelessness and get them the income that they need so that they can move forward and move out of homelessness and live successful lives. So, what is SOAR? SOAR is a model for assisting eligible individuals to apply for Social Security Administration disability benefits. It's for individuals who, for under the HUD definition, are experiencing homelessness or at risk of homelessness and have a serious mental illness, co-occurring substance use disorder, or any physical disability. It's supported by SAMHSA, which is the Substance Abuse and Mental Health Service Administration, in collaboration with the Social Security Administration since 2005, and all states within this country, including Washington, D.C., currently participates in the SOAR program. So let's break down the difference between SSI and SSDI, because even though they sound pretty similar and they do provide income to people who are living with a disability, they are still a little separate. So as you're looking at the slides, let me first go through the left side, which shows Supplemental Security Income, or SSI. It is an eligibility based on low income and resources, your living arrangements also impacts if you are eligible for those services. The monthly amount is based on the federal benefit rate of, for this year, 2022, it's $841 a month, and in 2021, it was $794. As you can see, every year there's a cost of living adjustment that helps to support a person's ability to live successfully, knowing that the cost of living goes up and can drastically influence that person's ability to get housing. So the date of eligibility is based on a protective filing date. What does that mean when I say protective filing date? For you as a case manager or anybody that first contacts Social Security to say, hey, I would like to apply for this benefit, that gets recorded as the first contact. And if that person becomes eligible for SSI, then Social Security will use that date, that first time that you contacted Social Security, to then start the payments for that specific benefit. Another great benefit to getting access to SSI is that health insurance is tied to it. Medicaid specifically is the health insurance that's tied to Medicaid. On the other hand, Social Security Disability Insurance, SSDI, that you're seeing on the right side of this slide, is tied to work. So eligibility is based on the insured status or your payments through your workforce payments and tax deductions. So the monthly amount is based on the earnings and your earning history. So for every person, the amount that you get based on the time that you put in is going to be a little different. It's not a set amount similar to SSI for an individual, as you can see with the $841 a month. It's different because now the money you get back is based on how much you put into the system. The date of eligibility is based on the date of onset of the disability. So when I talked about SSI, I said the day that you contacted Social Security was the day that when payments can first start. The difference with SSDI is that it's tied to when your disability actually began. So let's say that your disability began 5 years ago. That's the date that Social Security is going to show with documentation as when your disability started. However, they're only going to go back up to 12 months from that time. And Social Security disability payments actually begin 5 months post the disability date on record. One of the health benefits that is connected to SSDI is Medicare. So for SSI, it's Medicaid. For SSDI, the health insurance benefit is Medicare. So for the next slide, let's look a little bit deeper into eligibility for SSI and SSDI. So Social Security definition of disability is a little different from how you might think about it. So as a case manager, you're working with a client and you say, hey, my client is living with a serious mental illness, schizoaffective disorder, or major depressive disorder. And for you, you're assuming, hey, that's enough for that person to be eligible for Social Security, supplemental security income, or Social Security disability income. That's actually not the case. So let me use my name as kind of an example of two separate clients. So my name again is Chris John. Let's say Chris right now is living with schizoaffective disorder. Chris John with schizoaffective disorder can still get up in the morning, can still engage in daily activities of daily living, can still go to work, can still engage with family and other supports, and be functional. That is not enough. The diagnosis is not enough to determine that that person is eligible for Social Security, Supplemental Security disability income, or Social Security disability income. It's actually related to how that person functions, the severity of that diagnosis, and their lack of ability to engage in something called substantial gainful activity. So you have a diagnosis. What you would need to do as a case manager is to get that clinical documentation. Speak to that person's provider or get them connected to a provider. Get that clinical information, and based on how it reads, but also based on your observations of the person, their history, their lack of ability, based on their disability, to engage in work activity that's substantial, meaning that they're able to get income. Those are some of the major things, in addition to the duration, right? How long that person has been experiencing that disability directly impacts how that person might be eligible for SSI or SSDI. So what you would need to do, again, as a case manager, is to take everything that you thought about as it relates to applying for SSI and SSDI and reframe it to, is this person that I'm working with who is homeless or at risk of homelessness, is their disability severe enough? Are they living with it long enough? Right? And do I have documentation to prove that this person cannot meet something called SGA, or substantial gainful activity? And that's one of the major critical pieces of this as well. Let's move on to the next slide as it relates to a helpful tool that SOAR has created, a decision tree, to help you as a case manager determine whether or not the person that you're working with does meet the eligibility for SOAR specifically and for Social Security benefits or not. So if you look at this decision tree on this slide, you'll see that it walks you through some actually pretty easy steps. So first thing that you want to kind of question yourself is, should I complete a SOAR application with this person, right? First thing you need to realize, is this person homeless or at risk of homelessness? If they do not meet that criteria or that basic criteria, SOAR is not for you, right? Okay, you realize that the person that you're working with is homeless or at risk of homelessness. So does the individual, the child, youth, or adult, have a disabling condition, mental health, co-occurring substance use disorder, or a physical disability that, again, is severe enough, the duration, and also does it limit their ability from working and gaining substantial gainful activity? If yes, then is the individual experiencing or at risk of homelessness? Again, the SAMHSA and HUD definition of what that means. From there, what you're going to do is use the SOAR model and the SOAR critical components to help with the rest of the steps. If you look at the slide all the way to the right, you're going to see a list of 1 to 5. Those are the SOAR critical components that we would like you to walk through to help navigate the SOAR process. What does that look like? Serving as the applicant's representative. We know that working with somebody who is transient or homeless, or at risk of homelessness, sometimes communication with that person can be pretty difficult. And we know that there's some timelines when it comes to applying for Social Security. Becoming that person's applicant or representative takes a lot of the legwork out of helping that person navigate through that system. So what does this mean? There's a form called a 1696 that you'll learn about a little bit more when you go through the SOAR online course. That's going to be talked about a little bit later on in these slides. This means that at this point, with that person's permission, you get this 1696 form signed, you submit that to Social Security, and Social Security will communicate with you as well as that applicant and send you mail that person would get. You are able to call on that person's behalf and really take away some of the barriers that you would experience as a case manager when trying to coordinate services. Because if you were to call Social Security independent of having the 1696 in place, you would then have to find your client, again, who would maybe transient or homeless, have to get their permission to speak to Social Security, but guess what? You're going to have to call that 800 number and be on the line for the next representative, which sometimes could be a lengthy wait. Sometimes could be pretty quick, 30 minutes, an hour. Do you really have the luxury of that time to be able to do that? So getting the 1696 eliminates that barrier. Also, if that person gets mail, if you don't have the 1696, sometimes they lose it. Sometimes they discard it. Sometimes they don't see it or understand the importance of that paperwork. The 1696 sends mail to you at your location that you designate as well, so that you can open it, you can respond, and work with that person on their behalf as a representative. It is one of the major things that for SOAR that we've designed that really helps you as a case manager to work with somebody who is experiencing that level of crisis, which is homelessness. So the second thing, collecting and submitting medical records. Like I said, a diagnosis is not enough. What you need to do is speak to that person's provider or connect them to a provider and get those mental health or medical clinical records and use that as the medical evidence to show that this person cannot function and receive SGA, substantial gainful activity. Writing and submitting a medical summary report, which is number 3, the MSR. That's another amazing tool in your belt with supporting somebody. So the medical records that you're going to get from a clinical provider sometimes doesn't always give the information that you really need to show that person's functioning. However, you, with the boots on the ground, the eyes on the person every day, the one that's having a conversation with them, the one that's speaking with their family members, their friends, with the bodega owner, the person in the community, that's really giving you a lot of really significant, right, information about that person and how they function, allows you to now, in this medical summary report, put all of that into writing and use that medical summary report that comes from you as a case manager as medical evidence. You're saying to yourself at this point, how does something I read as a case manager be used as medical evidence? I'm not a doctor, right? But if you are connected to that person's provider and you take that write-up that you have that actually shows how that person truly functions in the community and you show it to them and they say, you know what, I actually agree with all of this because I'm seeing it as well. You ask that provider, that psychiatrist, right, that clinical person, somebody that has that license and that stamp to also sign off on your medical summary report. Your report also becomes medical evidence. And it is sometimes the tipping point between that person getting services and becoming eligible or not. So know that you have a lot of power based on your relationship with that individual within the community. Use that medical summary report to your advantage. The fourth thing on the right side, you'll see obtaining a co-signature on a medical summary report. Actually, I just went through that. And 5 is completing a quality review of the applicant prior to submission. So what does that mean? Review everything with your client. Make sure they are a part of this entire process. Make sure that you have everything that they've said, everything that they have experienced, all of their engagements with providers, all of their contacts down, right, and set, and that they are comfortable with everything that you're going to be submitting to Social Security. You follow these 5 steps called the SOAR critical components, and I can assure you, based on their eligibility to do SOAR, that you are putting them front line, right, to becoming eligible for SOAR. And again, it's going to put them in a very different situation than the traditional SOAR or SSI application for anybody else that is not experiencing homelessness or at risk of homelessness. So what you're going to see next is a cutaway to the actual presentation that we did at the Westchester Medical Center presenting SOAR. And we're going to take it up with now talking about what makes SOAR unique versus the regular process of a case manager or anybody that's assisting somebody to walk through the Social Security application process. So thank you, and take note of what's going to be coming up next. This here kind of ties into Ashley as well, and to even a lot of the services that Ashley provides under Search for Change and everything we're going to be talking about. Right? So it's more than just income, it's just money coming in, right? It's access to health care, the Medicaid and the Medicare that people might not have, right, which we will rectify, right? Increase education and employment opportunities, right? So people now can have the money, outside of free schooling, they can have the money to continue their education and do other things that they were limited from doing just simply because they did not have the income to do it. And decrease in incarcerations and hospitalizations. Many people may engage in criminal activity because guess what? They don't have the money to support themselves. So the recidivism rate and criminal justice involvement can be reduced in a lot of different ways. Now they have access to other services, even with the health insurance, they can be in treatment, they can be less symptomatic, they reduce those ED visits that of course can be astronomical in cost for people who are experiencing a lot of crisis as well. So again, think outside of the box as to the importance of doing this and doing it the right way and getting money in people's hands. In addition to also just bringing money back into the communities as well. So, the importance of doing this and how other states have done it. So other states, and these are top 10 states, Pennsylvania, Tennessee, Maryland, Arkansas, North Carolina, Oklahoma, Virginia, Washington, D.C., Oregon, Kansas, what they have done, 79% approval rate, right? So they're getting it done, and they're getting it done within a certain time frame. They are leading in taking this model and helping people who are homeless or at risk of homelessness that meets those eligibility criteria. What they have done is, and what we hope to do here in Westchester as well, to create local leads within all of your specific agencies, but somewhere down the road, if we can get the data to show that this is effective and working, to get paid SOAR staff in agencies to be able to take this on as well, right? Again, long-term dream, right? But we also have to show that it's working for us to be able to move in that direction. So again, critical components doing that. These states are doing this, and they're seeing a 79% rate of approval. So there's something that's called, is it here? The OAT. So there you go, that's your answer. So the online tracking with SOAR. So I actually have another slide that's gonna talk about OAT specifically. That if you do take the training and start doing SOAR applications, you put this information into OAT, and that's how we track that data as well, and it goes into the national database that can help show how New York and specific regions and counties are doing, so that we can use and pull that data to focus on grants and getting paid SOAR staff and all of those things. And that's what they did in those states. They used the OAT and the data tracking to increase their staffing. So it's not just me that's doing this to be able to support you. There's a whole technical assistance center in Albany. And when I say that, I'm not just talking them up because I want you to do this. They are so supportive. It's a little overwhelming too. They will call you, they will email you, what do you need, what's going on? There's this local SOAR representative that covers our region as well. When I say the amount of emails I get, and he will call me and say, hey Chris, what do we want to do for Westchester? How can we build this? How can I work towards making sure that your Social Security offices have that representative that you guys need and can talk to? And if they're not responsive, let me know and I'm getting on them to make sure that they're responsive. So there's a whole team of people that are a part of this. So doing the SOAR online course, which is what I will go through. The SOAR Leadership Academy is what I would like for all of you to do for your individual agencies. I would like to build up extensions of me for your individual agencies, where you can take this to support your own agencies and support your staff. So you can go through a specific training to be your own lead within your agency and to bring this information and support staff as well. So that's another opportunity. The OAT we're going to talk about. Library within the SOAR Works website has so much banked information that's useful. What we used to do, I went through a 4-day training, and that's how it used to be. They cut it down to, when we brought this to Westchester, a 2-day training that I was doing with my colleague at the time. Now it's an online course, a full online course that you have to take. So everywhere across the nation, everybody that wants to be SOAR trained does this course, and it standardizes our practice. The course is absolutely free. check this out, guys. If you're a social worker, this is free 20 hours of CEs to do the online course. Spread the word, right? And it's, of course, through NASW. It is self-guided. There's my next slide. So, the actual site, when you go on to take the online course, it's going to walk you through 7 different courses that you're seeing here, and within each course, like right here is one course. When you tap on it, which is the What is SOAR, you're going to have to go through all of these different things. It's information that you read, but also information, there's going to be videos embedded in there. As you complete this, you have to take a little practice test, and you have to pass that before you're moving on to the next course. And you have to do all of these to be considered SOAR trained. What's great about it, it takes about 20 hours to go through the entire thing. You don't have to finish it in one sitting, of course. You can start and stop it until you get to the full end. But it's extremely beneficial. And none of us, neither I, have ever gotten a training on how to do an application, right? The SSI 8000, all of those different things. It is difficult. There's so many questions. Does this mean this? Does that mean that? Now we're starting to guess what fits. What's great about this course, it walks you through both of the applications question by question and tells you what things mean and why you would need to check something off or not, right? So that is the benefit of this course as well. Not only that, but this right here, you get one of 2 practice cases that you have to complete on a person. So it's a video of a male or a female that's in crisis, that's homeless or at risk of homelessness, and you get to observe what their experiences are with being homeless. If they are living with a mental illness, you get to see them if they are disorganized, if they're confused, if they're angry, if whatever it might be, if they're incarcerated or whatever it is, and you get to see it and put that in your medical summary report. So it helps you to learn how to write it based on your observations. When the course is done and you're doing all of this, you then submit your full package to our Technical Assistance Center in Albany. They review it as if they are Social Security and let you know, hey, you did this right, you didn't do that right, can you recheck this? They'll send it back to you, and they want to make sure that you are doing it appropriately. Once they say that, hey, you know at this point how to successfully do a SOAR application, they'll give you the thumbs up, hey, you'll get all these fun emails, it'll explode, and now you're SOAR trained to be able to move forward and do these applications. So it's really a comprehensive training process through the SOAR online course. So again, 20 hours of training, you get 20 hours of CEs. Thinking about completing an application with a person, I'd say that it takes about 20 hours of engaging with that person and communicating back and forth to get everything done. And that's within that whole 90-day period that we're talking about as well. You're doing the SOAR critical components that I talked about. You're going to be tracking your outcomes in the OAT. And again, it's a benefit to your agency and the individuals you serve. Here's OAT that we were talking about. So the online application tracking. It's great. It's web-based. It's super easy. Like it's not complicated to put information in. It is HIPAA compliant. It monitors the quality, and it literally takes about 3 to 5 minutes for you to just enter the information on that client and what you've done and outcomes so that we can track it over time. So, wrapping this up and getting close to the end, so learn more about SOAR. Skip this. I am your bullet 3 at this point. So I'm your local lead. So if you have any questions, you can reach out to me. If you want to reach out and speak to our Albany support from the Technical Assistance Center, they are more than willing and happy to speak to you or anybody or your agency or your leadership to talk about how they can also bring this to your agency. If you want to do a group training and have them come down, because they will come down and do a group training for all of us and kind of overview, more extensive than what I'm doing, they will do that as well. So reach out to me, let me know what I need to coordinate for you. And register for the online course. It's super easy. You go to the website, and it'll right on the top says online course. You click it, register, and it just walks you through all of those modules. This is something I want to end with. It is when you go to the website, there's a little 5-minute video that helps you to understand the benefit of SOAR and walking through the process. And I want to play that for you right now before we end. Is that okay? Okay.
SOAR works. We see it in the daily transformations of people's lives. It is in the excited email from a SOAR caseworker who has received notice of their first approval. It is in the phone call from a participant sharing their concerns, getting connected with a SOAR provider, and soon unlocking the door to their first apartment. It is in this email from Sheila. The day my SOAR caseworker reached out to me and showed me I existed was the happiest moment in my life. SOAR providers and the applicants they serve have experienced this success over 55,000 times. We know SOAR works because we live it every day. There has never been an intervention that has the potential to make such a significant difference in the lives of people with disabilities who are experiencing or at risk of homelessness. Supplemental Security Income, also known as SSI, and Social Security Disability Insurance, also known as SSDI, are disability income benefits administered by the Social Security Administration, or SSA, that also provide Medicaid and/or Medicare health insurance to individuals who are eligible. The application process for SSI and SSDI is complicated and difficult to navigate. Nationally, about 31% of individuals who apply for these benefits are approved on initial application, and appeals take an average of over 1 year to complete. For people who are experiencing homelessness or who are returning to the community from institutions, jails, prisons, or hospitals, access to these programs can be extremely challenging. Approval on initial application for people who are experiencing homelessness and who have no one to assist them is about 10 to 15%. For those who have a serious mental illness, medical impairment, or co-occurring substance use disorder that impairs cognition, the application process is even more difficult. Yet accessing these benefits is often a critical first step in recovery. SSI, SSDI Outreach, Access and Recovery, known as SOAR, is a model program funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA. Nationally, SOAR applications are approved with a 65% approval rate in an average of 115 days. SOAR helps communities increase access to SSI and SSDI for individuals who are experiencing or at risk of homelessness through strategic planning that brings key stakeholders together to collaborate, agree upon a SOAR process for the submission and processing of SSI, SSDI applications, and develop an action plan for the implementation of their SOAR program. Training of caseworkers through the SOAR online course adult and child curricula. These comprehensive online trainings provide a step-by-step explanation of an approved SSI, SSDI application process. A Leadership Academy program creates strong local leaders to support SOAR-trained caseworkers and coordinate local SOAR programs. Technical assistance to states and communities, including support for action plan implementation, sustainability, and assistance with tracking outcomes, in order to document success and help access additional resources. For more information about SOAR and to get connected to your local SOAR community, please visit our website at soarworks.samhsa.gov.
All right. So here's some of those websites that are here. That you can go to. I'm sure we're going to be sharing all of this as well. And more information, thank you, and my contact information. So that is SOAR in a nutshell. If you do have any interest in this, and I hope you do, because you will realize how much it benefits you, even the general knowledge of even how to navigate Social Security and make applications, it'll benefit you no matter what. If you work with the homeless population or not, this knowledge and information is going to be super beneficial. So I would just suggest you take it anyway.
You're doing very, very important work. I've one who's been around the block a few times. I'm about to celebrate my 30th anniversary with my agency. I started right out of elementary school, so I was a bit of a prodigy. Not quite as old as I look. But I know how difficult the work is that you do working with individuals in need. As Joe said, some of society's most vulnerable. And you're doing it at an exceptionally critical time. I don't need to tell you just how great the need is now. The pandemic has only exacerbated the need. So I thank you for doing the most important work and the most difficult work under difficult circumstances. Please hang in there, because helping individuals in need is our most noble calling, and I hope that you can find some of the rewards even when it seems thankless at times. As Chris said, as Joe said, part of what we're trying to do through this series of trainings is to give you some of the tools to make your work a little bit easier, a little bit more effective, and of course, to ultimately serve the individuals who are entrusted to your care. So I thank you for that. I know this topic, financial benefits and entitlements, might seem a little bit stale, a little bit dry to some of you. Most of us have not gotten into social work or human services to learn about benefits and entitlements. But as Chris said, and as I think common sense tells us, if we can't help people, the most vulnerable people, to get basic resources that they need, cash assistance, food in the refrigerator, a roof over their heads, there's not a lot else that we can do for them. And what I'm about to say is not a knock against treatment providers. Treatment's essential. We have to have treatment for people with mental health issues, substance use issues, physical disabilities. But at the end of the day, no matter how effective the treatment is, if someone doesn't have money in the bank, or money to buy a sandwich, or food in the refrigerator, or a safe place to call home, that treatment's for naught. So helping people to navigate this complex system of accessing financial benefits and entitlements is integral to social work. I think you all recognize that, but it bears repeating. So sometimes when you get steeped in this and you wonder, gee, is this what I signed up for? Remember that, yeah, this is what you signed up for, and it's essential to helping the people who are entrusted to our care. So a couple other things before we get started. I will say that Chris and I actually didn't coordinate our trainings in advance of today. We probably should have, but actually it's working out perfectly, because I'm going to repeat elements of what he discussed, but in some ways our presentations build off of each other, because he focused a lot on SOAR, which, as you learned, is about helping people in the preliminary application process. Much of what I'm going to discuss is post-application. It's going to be about what happens after individuals have been approved for Social Security and SSI benefits, and also how those benefits might be impacted by work activity. Because one of the goals that I think we have collectively is to help people to become employed or to find some meaningful activity. Let's face it, a lot of people who we work with don't necessarily want to be collecting benefits. They do because it's necessary, and I imagine some of you, some of us have. That's why they're there. But many of the people with whom we're working aspire to go on to careers, to meaningful jobs, to paychecks, all the things to which all of us aspire. But many of them are concerned about doing so for fear that wages, employment is going to adversely impact their eligibility for benefits. I have some good news to share. Chris touched on this, but I'm going to elaborate further, that there are SSI and SSDI work incentive programs that help people to preserve their benefits, and that extends to health insurance like Medicaid and Medicare as well. So I'm going to kick off at a high level talking about some other benefits that are available to individuals, largely through the Department of Social Services, and I imagine many of you are familiar with that. And then we're going to get into some more of what I discussed about SSI and SSD, and I think it will repeat elements of what Chris shared, but it will also build on it as well. A couple of additional things I'll just say. Not sending any of you back today as experts in benefits and entitlements. Number one, I couldn't, because I'm not an expert in benefits and entitlements. There is no expert in benefits and entitlements. That is a very broad umbrella. We could spend a month talking about food stamps. I mean, food stamps, otherwise known as SNAP benefits, I'm going to touch on that, and I imagine all of you have heard of food stamps and SNAP benefits and work with individuals who receive them, is an extraordinarily complex program. Eligibility can vary according to numerous factors. There's no way we can get into that. Same with SSI, with SSD, with temporary assistance, with safety net assistance. The list goes on and on and on. What I hope you learn today is that there are resources that you can access that will help you to help your clients navigate that. Chris touched on that. Obviously, SOAR is one of them. I'm also going to leave you with some resources. I do have some handouts as well. That includes a comprehensive list of sites that you can go to for additional information about virtually any benefit program under the sun. So what I hope to leave you with today is a high-level understanding of how some of this works, a more granular understanding of how certain elements, but most importantly, knowledge of where to go to get additional answers to some of the most pressing questions that you and your clients have. If you leave with that today, we'll call that a win. I will also say about my presentation, I unfortunately don't have a caveat or disclaimer. This doesn't belong to SAMHSA. This belongs to, frankly, me. So if you're unhappy with it, feel free to complain to me. I can't blame SAMHSA. I can't blame the federal government. I can't blame the local government. I could try to, but unfortunately, this is all on me. I have borrowed elements of it, of course, from other knowledgeable sources, but this is the property of Ashley Brody and Search for Change. As Desh said, I am the Chief Executive Officer of Search for Change. We're one of many agencies in Westchester. We also serve Putnam County as well that provides supportive housing, care management services, vocational rehab, and other services for individuals with serious mental health conditions, of course, co-occurring substance use disorders and other conditions. And housing is our stock and trade. It's what we do and what we were established to do back in 1976, and primarily what we do, and view it as a critical benefit. Let's face it, we all need to have a place that we call home, and that's what we've been doing. But as part of my career at the agency, I've had a chance to learn a bit about benefits. Again, I claim no great expertise in any one element, but I've learned enough that I hopefully can guide you and guide others. So we will jump right in. So I should mention, I delivered this training, or some version of it a few years ago. I included this slide then. I was thinking about taking it out until I realized it's probably more applicable now than it was then. Right? Raise your hand if you have a student loan. Right? Yeah. Well, let's hope Social Security is around in a few years so we can all pay off our student loans. I'm still paying off mine. I imagine you are too, right? Let's hope Social Security is around in a few years so we can buy a tank of gas and groceries. Forget about student loans, right? So, anyway. So I mentioned before I get into the weeds of Social Security, approaching it from a slightly different perspective from which Chris came, I want to talk a little bit about other benefits that are available for individuals, largely through what we know as the Department of Social Services. I imagine most of you know of the Department of Social Services, or DSS. In the city, it's the Human Resources Administration, but in the rest of the state, it's DSS, Department of Social Services. Again, we could spend a year talking about what DSS does, right? You probably realize that. At a high level, I just want to mention a few benefit programs that operate under the auspice of DSS. So most of you have probably heard of temporary assistance. Temporary assistance includes different types of cash assistance for eligible individuals, and it's broken down into different segments. Family assistance is a form of assistance that provides cash for individuals who qualify in accordance with these criteria, eligible families with minor children. There are lifetime limits on this. Sometimes there are work requirements that may be applied. That was not always the case. Once upon a time, individuals who had limited income or no income could go into Department of Social Services, apply, and get cash assistance relatively quickly, much more quickly than you can get Social Security benefits. As Chris explained, and as I'll repeat, Social Security benefits are predicated on disability. You must have a disabling condition as defined by Social Security in order to qualify for that. DSS does not require you necessarily to have a disability to receive cash benefits. Now, if they determine you are not disabled, you might be subject to certain work requirements in order to receive cash assistance, but it's not a bona fide requirement. So one category of assistance known as family assistance is available for eligible families with minor children, and again, there are lifetime limits and work requirements. Some of those requirements were instituted many years ago during a period known as quote-unquote welfare reform. Those of you who have been around as long as I have might remember that. Unfortunately, our society, as we know, has not always had the most forgiving attitude towards our most vulnerable, and there was a lot of momentum in Congress a number of years ago to impose caps, limitations on some of this assistance, and that's when some of these lifetime limits and work requirements were incorporated. DSS also administers what's known as safety net assistance. It's very similar to family assistance, but it extends to a broader category of individuals, many of whom may not qualify for family assistance, either because they don't have children in their households, so as this slide indicates, single adult childless couples, or children who are living apart from their parents or guardians may qualify for this. Also undocumented individuals who would qualify for temporary assistance but don't qualify federally because they are undocumented may receive safety net assistance. Likewise, work requirements may apply. There are lifetime limits on this, and treatment requirements may apply. So I mentioned that if you are deemed quote-unquote disabled by Department of Social Services, you might be required to participate in a course of treatment in order to receive benefits. If you are not deemed disabled, or if you're deemed able-bodied, that's the language that they use, and able to work, you may be required to work. So there are conditions attached to the receipt of some of these benefits that didn't always apply historically, but do now. There's also a broad category known as emergency assistance. So again, if someone loses their housing, or someone can't pay their electricity bill or their heating bill, or someone has no food in their refrigerator, someone is fleeing from domestic violence, has any number of other needs for which they need immediate assistance, the Department of Social Services might be able to assist. I'm going to emphasize might, doesn't mean they will, right? Because we know that there's a long list of exclusionary criteria that can apply in some instances, and it's beyond the scope of this training to go into all of them, but again, I'm going to leave you with a resource that you can go to for additional information. But I imagine all of you have worked with or will work with individuals who are facing those imminent crises. It might not be something that can be immediately fixed by cash per se. Cash can fix most things, let's face it, right? But it's something that needs to be addressed through some other means. So again, you know, if someone is lacking heat or utilities or is facing a pending eviction, DSS might be able to assist in these instances or refer you or someone to an agency or organization that can assist. So these are three overarching categories of assistance that are available through the Department of Social Services. Of course, the Supplemental Nutrition Assistance Program, formerly known as food stamps. I'm guessing all or almost all of you have heard of food stamps, or what's now known as SNAP. You know, interestingly, SNAP is a federal program. It's actually administered by the Department of Agriculture, but it's instituted on a local level. And that too, of course, as we know, can supplement individuals' food budgets. They were historically called food stamps because they used to be issued as stamps, much like cash. No longer done that. I think, as many of you probably know, it's all done electronically. So individuals receive an EBT, an electronic benefits transfer card. They use it much like a debit card to bring to the grocery store or to a point of sale with which to purchase groceries or eligible items. And this slide enumerates some of the eligibility criteria. The monthly allotments that one receives can vary based on household characteristics, a whole variety of factors. Eligibility criteria can vary. Don't expect any of you to memorize all of this, although feel free to if you want. And again, I can always get you this information. You can access it through some of the sites that I'll share. But suffice it to say that the amount of an individual's food stamp allotment will vary in accordance with many, many factors. When in doubt, I often advise people to apply. And if you're not sure if someone is eligible, there are different benefit calculators that you can access online and through some of the resources that I'll share. But my advice to everybody in most instances is to apply for a benefit, even if you're not sure eligibility is there. The worst they can say is no, and then there's often appeal rights. Yep. Question? Yeah.
I do. For families who are undocumented, may have children who are U.S. citizens, can they apply for that?
They can, yes, absolutely. And I can't guarantee you that they will be deemed eligible because there could be some other factor unique to this circumstance that may include or exclude them. But based on just that information that you shared, they can apply and should apply, absolutely.
I had a question actually with a client who, when they asked for the Social Security information, I was not sure how to assist with them, put it in or not. What do we do?
You mean it for...
Child Social Security number?
Oh, you mean so if the adult does not have a Social Security number? In that case, I would use the child's, exactly. In most instances, even if it's an undocumented family, if there's a child who's a citizen, almost invariably they will grant certain types of emergency assistance, and that would include food stamps, absolutely. Yeah, in most cases, certainly if the child is a citizen, and even if the child isn't, there's assistance that's available for undocumented immigrants, cash assistance, food stamps, yep.
I'm so sorry to interrupt.
That's okay.
The applicant will be the child then?
In that case, it could actually be either. Food stamps can be given to undocumented individuals, exactly. But if there's children involved in the household and the children are U.S. citizens, then by all means, that would enhance the eligibility. Absolutely. No, you bet, by all means. And also, and I realize, all of you are working with individuals about whom you might have many questions. I know we may not be able to address every particular question, but I will make sure that you have my contact information and also general repository resources to which you can turn so you can get additional information. What I found through doing this for many years is that you kind of build resources as you go. And I know Chris left you with some resources. I'm going to leave you with some resources. There's no one central point of information for all of this because no one has all the answers. And also, these situations get so inherent inherently complex because it's based on a whole variety of factors, and we can spend all year on them, but do want you to take away some key resources so you know where to turn for those answers when they seem fleeting. Okay, so I think this covers food stamps as much as we can. This is a resource that's available online. So if you, I mean, you can find this through a Google search, but the Office of Temporary and Disability Assistance, it's a state agency that shares some of the responsibility with local Department of Social Services for administering many of these benefits, can be accessed through this site, and you can locate your local Department of Social Services through that site. There are a handful of district offices in Westchester. Some counties have one district office, some counties have no district office, and they share them with others. Again, in New York City or the 5 boroughs, it all operates under the umbrella of the Human Resources Administration, but in Westchester or anywhere else in New York State, you can locate your local DSS office by clicking on that link. Also, a lot of benefits can be obtained online right now. Chris talked a lot about applying for SOAR benefits, applying for SOAR certification and Social Security benefits online. You can also apply for many DSS administered benefits online through the mybenefits.ny.gov portal. Not all benefits, many of them do still require a face-to-face visit in the local district office or what may be a Zoom visit during the time of COVID, but there are more benefits that can be accessed online now than was the case previously, so I certainly advise you to help your clients with that if that's possible. I realize you may be working with many individuals who don't even have a place to call home, let alone a computer or a secure internet connection, but if you have the occasion to have them come to your office or to bring them the technology, you can assist them with that. Okay. So moving on, and again, that was a high-level overview of the benefits that are generally available through the Department of Social Services. Wanted to start with that because, wanted to start with that because up until now, when you look at what Chris shared, coupled with what I'm about to share, it's been focused largely on Social Security benefits. And again, Social Security benefits, which includes 2 different components, and I'll repeat that again, are given largely to individuals who qualify in accordance with disability. But you're working with many individuals, I'm sure, who have not yet been deemed disabled by Social Security, and they need to know where to go to get other benefits. So let's get into Social Security now. All right, there we go. And again, we'll leave time for questions at the very end if you have any. So I'm going to probably move quickly through some of this because it's a repeat of what Chris shared, but it bears repeating, especially for those of you who might be relatively new to the field and don't have a whole lot of experience with Social Security, at least as it relates to individuals with disabilities. Look, most of us know about Social Security because we grew up hearing about Social Security, but when we hear about Social Security on the news, on the radio, our family talking about it, it's largely in the context of a retirement benefit, right? You hear about people who get Social Security once they retire or reach their established retirement age. That's a different Social Security benefit. It's actually officially known as Social Security Old Age Retirement Benefits. I think the word old age is in there somewhere. We refer to it as Social Security Retirement. But for the purpose of this training, we of course are talking about a different benefit that's given to individuals who qualify based on a disabling condition. Chris went into that. I'll repeat certain elements of it. So again, you heard this earlier, Social Security Administration administers a couple of benefit programs that are available to provide cash assistance for individuals who are unable to work due to a substantial medical impairment. And as Chris shared with you, and as I'll repeat, if somebody is unable to engage in what's defined as substantial gainful work activity due to a medical impairment, which could be physical in nature, it could be emotional or mental in nature, that has lasted and can be expected to last for at least a year or be terminal, result in death, that individual might qualify for a benefit payment. This is a very key component of the definition because many people may come to you, you may be working with people right now who will say to you, you know what, I need Social Security because I have a medical condition and I can't work. And you might begin to ask them some questions, do some probing, and you might find out, okay, maybe this individual was in a car accident, regrettably, and is recovering, but is going to be healthy again within 6 months or 9 months. We've all had injuries in our lives and setbacks. There might be other benefits for which that individual is eligible. There's short-term disability, there's other types of disability, but Social Security disability is only given to individuals who have a medical condition that has lasted or can be expected to last at least a year. So there's a duration requirement associated with this that must be considered. And the impairment must be severe enough as to prevent the individual from engaging in substantial gainful work activity. Chris mentioned that phrase, I'm repeating it. Many of you may ask, well, what exactly does that mean? Because we haven't really defined it up until now, I don't think. we all have a different idea of what it means to work substantially. You know, when someone says to me, Ashley, do you do substantial work? I would say, yeah, I do. I'm the CEO of an organization. I think most would consider that to be substantial. All right, well, that's my opinion. You may ask, you know, someone else, and they say, yeah, you know, I'm working part-time at a grocery store. That's not substantial. You know, it's not substantial work. I want a full-time job. I want to do something else. You may ask a third person, a fourth person, a fifth person. You'll get 5 different opinions of what substantial work is, right? That sounds subjective, right? It is subjective. The word substantial is subjective. What's substantial to me is not substantial to the next person, and so on. Well, needless to say, we can't have a system operating in accordance with this subjective interpretation of what substantial is. We have to have some way of defining what substantial is. So, in 2021, if you are working and earning gross monthly wages that produces income of at least $1,310 a month, you will be considered to be engaging in substantial gainful work activity. So let's parse that a bit. Does everyone know the difference between gross and net? Just in case anyone doesn't, not putting one on the spot. I didn't until I started to learn about this. You're all working in social services. You get a paycheck every week or every 2 weeks. The small number on your paycheck is the gross pay. The smaller number is the net. Okay? Got it? That's how I remember. All right? The small number is the gross. The smaller number is the net. That's the bad news. All right? So what does this mean? Let's say I'm working part-time at a grocery store. All right? And let's say, you know, I'm taking home, you know, I don't know, $400 a week, right? Just throwing that out there. Well, what does rent go for in Westchester right now? Okay, I know the news only gets better. Happy Friday. We won't even get into the bidding war on rental markets and all of that during the pandemic. We know what the rent is in Westchester, okay? So let's say you're working part-time, you're grossing $400 a week. Grossing $400 a week, that means you're netting maybe $300, $320, $330 after taxes and all the deductions, okay? So if you're grossing $400 a week, that means you're grossing $1,600 a month. You're netting maybe, you know, $1,200, maybe. Well, you can't pay rent on that in Westchester, let alone meet all your other expenses. Nevertheless, according to Social Security's definition, you are working at a substantial level, and you wouldn't qualify. So, to take this example a bit further, if you have a medical condition, a disability, it could be a psychiatric condition, could be a physical condition, could be some combination of medical impairments, but despite that, you're able to do some work. You're able to work part-time at a grocery store, grossing $400 a month. Social Security would say to you, I'm sorry, we can't give you a benefit because you're working at a substantial level. And you would say to them, aghast, how can you call that substantial? It's not logical, it's not fair. No one's claiming that it is. If you talk to Social Security, they wouldn't say it's fair. These are just benchmarks that are set by the federal government for a reason that's somewhat obvious. The federal government is not looking to make it easy for people to qualify for benefits, right? Now, I will say that threshold, that $13.10 threshold is increased from last year, and it will increase again next year. It didn't always increase. For many years, it remained unchanged. It was set at a very low level, but there was such an outcry from the advocacy community and individuals with disabilities and special needs that they gradually began to increase it. And there is some good news, too. The fact that the SOAR program exists right now is some good news. That didn't exist until a few years ago either. So we can see as much as there's momentum against granting people benefits, there's also momentum and advocacy in favor of people getting it and making these allowances a little bit more generous than they used to be. But you still need to know the facts. And again, not here to tell you what's right or wrong or what's fair or what's unfair. That, too, is up to you to decide. Having this information helps you to advise your client. So if a client comes to you and says, oh, you know what, I sustained this accident or injury, or I have this diagnosis, and my doctor says I really shouldn't be working full-time, I'm working part-time, but it's not substantial, so I want to go for benefits, you can ask them and say, well, can you define, you know, what your work is? How much are you earning? And if you find that they're earning more than this, you know, you might tell them, okay, you can apply. I wouldn't discourage someone from applying, but if you are working at this level, it's quite possible you will be not denied because Social Security will conclude that you are able to work at what they define as a substantial level despite your disability. So it's unfortunate, but having the information helps you to help them. Now, If an individual does qualify or meet the two basic eligibility criteria, and again, to qualify for any benefit through Social Security, or at least one that's based on disability, you must demonstrate that you have a medical condition that has lasted or can be expected to last at least 12 months, and that precludes the performance of substantial gainful activity as we defined it. If you do meet those criteria, and you apply, and Social Security agrees that you meet those criteria, Social Security will conclude that you'll receive one or the other benefit: Social Security disability insurance, supplemental security income. Chris touched on this a little bit. I'm going to go into a little bit more detail about the differences between these two benefit programs, because this is a source of a lot of confusion for people. Continues to be, understandably, because there are similarities between the programs. In order to qualify for either, you must meet the same eligibility criteria, but there are also many differences, and we're going to get into some of that. Okay. We're going to start with Social Security disability insurance, and hopefully by the end of this you will understand the distinction between the two. So Social Security disability insurance essentially is an insurance program, and that's how I think of it, and that's how I remember it, and this might help you to understand it. So individuals who have become disabled, again as defined by Social Security, but who have a work history and have paid taxes into the Federal Social Security Trust Fund and have paid enough taxes, and by that I mean have met certain criteria established by the Social Security Administration, might qualify for SSDI, Social Security Disability Insurance payments, upon determination of a disability if they have worked enough. And what do I mean by enough? So think of it as, again, an insurance policy. I'll use an automobile insurance policy as an example. So, every month I send my payment to Allstate, so my vehicle is insured. I hope I never have to submit a claim, I hope I never get into an accident, I hope my car's not stolen, what have you. But let's say I get into an accident, my car's stolen, I'm in a fender bender, what have you. I call up Allstate, I said I need to submit a claim, they'll pay out my claim. Social Security disability insurance essentially works the same way. All of us are working, right? And we all take home a paycheck. And remember, there's that small number, the smaller number. Well, why is the smaller number a smaller number? The smaller number, which is your net pay, is smaller than the gross because some of the pay that you would otherwise take home is going into, as Chris said, the FICA, Federal Income Contributions Act. It's going to the Federal Social Security Trust Fund and is insuring you against future disability and for retirement. So if you are working, and if you have worked or earned enough work credits since you started working and have paid enough into the FICA Trust Fund, and you become disabled as defined by Social Security Administration, you can then receive a monthly payment. The monthly payment that you receive is roughly commensurate with the amount that you've paid into the system. That's why SSDI amounts vary. So if any of you are wondering, gee, why does one client receive X amount in SSDI and the next client receives Y or Z? You may be wondering about that. I did for many years. That's generally why. If you have two individuals who are receiving Social Security disability insurance, seldom is it the same amount, because the amount they receive is based on their insured status, which could be through their own record, or in some instances it could be through the work record of a parent or guardian, and we'll get into that in a little bit. But in many cases, if you're working with an individual who's receiving Social Security disability insurance, it's because they were deemed disabled by Social Security. That is, again, they have a condition or have had a condition that's lasted or been expected to last for at least a year. They're unable to engage in substantial work activity, and their past work history, or in some instances the work history of a parent or guardian on whose record they're disabled, allows them to qualify for a payment. And again, how much that payment is will vary in accordance with how much has been paid into the trust fund. Does that make sense? More or less? Okay. And again, don't feel you have to memorize all of this. Want you to be exposed to it so you have a general understanding. Now, what about individuals who meet the disability criteria? Again, I'm going to keep repeating this because it's important to understand. Don't mean to sound like a broken record, but once again, if you've had a medical condition that has lasted or can be expected to last at least a year and precludes the performance of substantial gainful work activity, you meet the disability criteria. But what if you haven't worked in your life, or you haven't worked enough, as Social Security defines it, and they have a relatively complex formula through which they make that determination. But let's say you have not worked enough to Social Security satisfaction to qualify for an SSDI benefit, but you're nevertheless disabled, you're unable to work, and you have a medical condition that's considered serious as we defined it. In that case, you would qualify for supplemental security income. If you understand what SSDI and SSI signify, it will help you to get the two straight. So again, SSDI is the acronym that signifies Social Security Disability Insurance, SSDI. Think of it as an insurance policy. If you worked and paid tax into the trust fund, you have insured yourself. If you haven't, you haven't. And then you qualify for SSI, which stands for Supplemental Security Income. SSI is meant to do just that, supplement other sources of income. So if you receive SSDI, but the SSDI amount that you receive is below a certain threshold, you may qualify for a supplement in the form of an SSI payment. Or if you receive no SSDI and have no other source of income, then you would qualify for SSI at a higher level. So SSI fluctuates for someone based on whatever other sources of income they have. And again, it's meant to take the place of or to supplement SSDI if SSDI is not available or if the amount is insufficient. So you're going to work with some individuals who receive SSDI. You're going to work with some individuals who receive SSI. You're going to work with some individuals who receive both. The reason why some individuals receive both is because if their SSDI is available, but the amount is low, all these amounts are low, but we'll say it's low even by Social Security standards, below what they define as the federal benefit rate, because they haven't worked that much and paid much into the system or qualified for a substantial benefit, that will be supplemented by SSI. So in some instances, you'll see someone who will receive both benefits. In many cases, it will be just one or the other. But these are essentially the reasons why. Does that make sense, more or less? Okay. Now, like I said, we'll leave time for questions at the end. Now, one thing that Chris didn't get into, that we'll get into now, is Social Security benefits and employment. Again, just to kind of recap what we've done so far this morning, I think Chris did a great job of talking about the pre-application process and the different benefits that accrue to SOAR-trained representatives and how the SOAR program can help people to establish eligibility in the first place. We talked a little bit more about how Social Security determines who's eligible for SSI versus SSDI. Invariably, people get to a point where they have SSI, they have SSDI, and then they decide, okay, well, what do I do now? Again, most people, and most of the people with whom you're working, don't want to be on SSI or SSDI forever. It's not meant to be. It's meant to be a conduit to stability, to self-sufficiency, hopefully to work activity again once people are ready and able to resume life in the workaday world. But a question that people have is this: well, what happens to my benefits if I go back to work? I imagine you are currently working with individuals, or you will be, who might be fearful of losing their SSI and SSDI if they go back to work. Because even with SOAR, and SOAR is a wonderful addition to our toolbox, even with SOAR and even with the assistance SOAR provides in facilitating the application process, it's still time-consuming. It's still onerous. There's no guarantee that someone who applies is going to get benefits. And many people don't. Many people do have to appeal. Many people do have to appeal multiple times and wait, in some cases, years to get Social Security or SSI, even if they're eligible. So although SOAR and other incentives have streamlined this process, none of them provide a guarantee that someone is going to get benefits. So people are naturally reluctant to do anything that's going to jeopardize it, especially if it's their lifeline. If all you have is SSI and SSDI, or perhaps food stamps or something else from the Department of Social Services, and you fear going back to work is going to put that in jeopardy, that's going to serve as a powerful disincentive to work. Even if you feel like you're emotionally, psychologically ready, physically ready, you have the skill set, you might think twice, 3 or 4 times before you go back to work if you fear that you're going to jeopardize your benefits. There's some good news here. Social Security and SSI do have some fairly robust work incentives. It's what they call them, work incentives, built into their programs that allow people to gradually return to work without putting their benefits in any serious jeopardy. And we're going to get into some of that now, because this does come up oftentimes for individuals. And this is also where there's a distinction between the two programs. Again, I said at the outset that there's a lot that unites SSI and SSD, but there's a lot that's different. And this is very important to understand at a high level, at least, to help your clients understand. Because all too often, I've encountered this many times in my career, and I imagine you have too, is this: individuals who know each other, clients of yours, individuals in the community who receive benefits, will compare notes and chat. One person may receive SSI and say, I went back to work and this is what happened to my check. And their friend might say, oh, well, I went back to work and my check didn't change. Well, one may be receiving SSI, the other might be receiving SSDI. It's very important for us and for our clients, the people we serve, to understand that the work incentives, though available, do vary by benefit program. So there's not a one-size-fits-all approach. So it's very important to understand, as with all things related to benefits entitlements, that you have to take each individual on a case-by-case basis and not jump to any conclusions based on someone else's experience. So Social Security, disability insurance, and SSI, supplemental security income, apply different work incentive programs. So we're going to take each in turn and start with Social Security disability. Social Security disability insurance offers what most would regard as a more generous work incentive package. By that I mean, if you receive SSDI, if you've been deemed eligible to receive that benefit because you fulfill the basic eligibility criteria, and you've paid into the trust fund through your work activity or the work activity of someone else on whose record you're insured, you can go back to work and work at a fairly significant level for quite a while without seeing any change in your benefit. That's right. If you receive a monthly SSDI check, whatever that amount is, and you're going back to work for the first time since you've been deemed disabled and started receiving this check, you can actually earn as much as you want to, and your check won't change at all. So I'll give you an example. Let's say I have been deemed disabled. Let's say I was diagnosed with schizophrenia a number of years ago and have really been unable to work as a result of it. But I've worked my recovery. I've gotten to a point where I'm stable. I haven't had hospitalizations in a while. I have a skill set because prior to the onset of my illness, I was working in the trade and earning a pretty decent salary, and now I feel like I'm ready to go back to work again, and I'm receiving a Social Security disability insurance benefit of $1,000 a month. And let's say I'm going to jump in with both feet. I'm going to get a full-time job. Let's say I was a plumber, just throwing that out there. And plumbers make more than most of us, right? They get paid pretty well. And I go back and let's say I earn $1,500 the first month, just throwing that number out there, okay? And that's like working part-time maybe, but let's say I earn $1,500 a month. I would keep my full SSDI benefit at that rate, even at much higher. The reason being, Social Security disability insurance offers its beneficiaries a trial work period. This trial work period is just that. It's a period during which an SSDI beneficiary can work and earn as much as he or she wants to without experiencing any change, any offset, any reduction in the monthly SSDI payment. And this period can go on for a minimum of 9 months and sometimes considerably longer, because only those months in which the gross earnings exceed 940, and these are 2021 figures, would be counted towards the trial work period. So let's refine this example a bit further. I go back to work, I'm receiving $1,000 a month in SSDI, and I'm earning $1,500 a month. Well, $1,500 a month is above that $940 threshold. So that means my first month of work activity at that level would count as 1 month towards my 9 months of trial work activity. But I still would not see any change in my SSDI. I'd receive my full $1,000 SSDI benefit, and in addition, I would receive the $1,500 that I'm earning. A little bit less if it's gross. Yes, question?
If somebody was incarcerated and they have to re-put their benefits on,
Yep.
do they get this trial period again, or is it just a one-time thing?
You're allowed one trial work period per life of your benefit case. So sometimes if people, if they lose their benefits and have to reapply and reestablish a new case, then they're given a new trial work period. But if it's just a reinstatement of an existing case, then it would be a resumption of the prior trial work period.
And if this person worked, like, let's say they tried to work when they first started.
Yep.
And failed, and it didn't work out, and only worked for like a month, they still are able to do this? Even if they only worked for 1 month?
They are. Well, it's interesting. The 9 months must be expended during a rolling 60-month period. So what does that mean? And this gets into the weeds a little bit, but I'll try to explain as best as I can. So you are allowed 9 months of work activity per life of disability case, but those 9 months to be completed have to be expended within a 60-month period. So there's essentially a 60-month, a 5-year look back. So if in the example you cited, if the individual has been unemployed for many years, but let's say many years ago did work. If all that work activity happened more than 5 years ago, then for all intents and purposes, that person will be starting from scratch. But let's say that individual did, 6 months of trial work activity, and 4 of those months were 8 years ago, but 2 of those months were 3 years ago. Those 2 months would be counted towards the remaining 7 months.
So this is like, it's kind of case by case, like when they talk to Social Security, it would be best to say, I worked
Absolutely.
2 years ago,
absolutely.
That if they did work, and let's say they only made like $100, like it was like, not a lot of money, it wouldn't have.
It wouldn't count exactly because it would be below this trial work period service threshold. Yep, no question, no problem. You can request, your clients can request from Social Security a work activity report, which will produce Social Security's record of an individual's earnings history, with one caveat. That information is not always correct. Now you might think, okay, because I requested this information from Social Security and they've given it to me, I must therefore be able to rely on it. Oftentimes, Social Security will rely on information they receive from a recipient, and if that information is incorrect, that old phrase, garbage in, garbage out, if the information they've gotten is not accurate, then the information you get from Social Security may not be accurate. So unfortunately, Social Security always puts the onus on the recipient of furnishing correct information. So whenever you receive a work activity report from Social Security, you still want to dot your I's and cross your T's and review it with your recipient, with your client, to make sure it's accurate as best as you can, because sometimes even Social Security's records aren't accurate. Social Security is supposed to go in and periodically review the information that's publicly available. So for instance, we're all working on the books because we're working for legitimate agencies, I think and hope, right, that are paying taxes on our behalf, and we receive paychecks. Social Security receives reports of our earnings. They may not receive them every day, every week, every month, but periodically Social Security will get updates about what we're earning, what's being paid in. And the same is true for individuals we serve. So if they've had jobs that are on the books, Social Security typically will go in and verify those earnings, but I can't tell you that it's always going to be 100% accurate. So I always want to interject that caveat. When you ask for a work activity report, getting information from Social Security, it's good to review it with your clients and make sure it's accurate, or at least run it by them to see if they agree that it's accurate. But getting back to your point, yes, if in this example someone worked, many, many years ago, that would not count towards this trial work period. If the work were more recent within that retrospective 60-month period, then those months would count. And I realize sometimes you might not be able to make that determination. That's why it's best to kind of sit down and develop a work history with your clients and do that with a Social Security representative if you can. So getting back to this example, yes, this is somewhat good news, I think, depending on your perspective. Somebody who has SSDI and is going back to work for the first time, or maybe not even the first time, and is earning a substantial wage, can continue to receive a monthly SSDI payment for at least 9 months, and not every month of work activities even necessarily going to count towards that. So let's take the example a bit further. Again, I have $1,000 a month in SSDI. I go back to work. I'm earning $1,500 a month. That amount would be counted towards the trial work period because it's in excess of that 940 threshold. But let's say after my first month I decide I've kind of jumped the gun. I'm not really ready for full-time work yet, or even part-time work. I'm going to work a few hours a week, maybe take on something a little bit less, maybe do some intermittent work so I can be sure that I'm ready. And instead of earning $1,500 a month, I'm earning $500 a month or $800 a month. Well, I can continue to work and earn those wages and continue to receive my full SSDI, and that work activity is not even going to count towards my trial work period because it's below that 940 threshold. So what that means for all intents and purposes is if I'm an SSDI beneficiary, I can go back to work and earn $800 a month, month after month, year after year, if I so choose, and I'll continue to receive my full SSDI benefit. So Social Security has basically determined that if you're an SSDI beneficiary and you're earning less than this, that they're going to basically look the other way and say, okay, you can earn that much and we're going to allow you to keep your SSDI. It's not the same for SSI. We'll get into that in a little bit. SSI is not quite as generous when it comes to its work incentives or its allocations, but for SSDI, there is some good news. So once again, if you're an SSDI beneficiary, you're allowed this trial work period. It's a period of 9, not necessarily consecutive months, during which you can work and earn as much as you want to without experiencing any reduction in your SSDI. So if you're working with a client who says to you, I'm an SSDI beneficiary, I haven't worked since the onset of my disability, or maybe I did, but I earned a little bit, I'm worried about going back to work because I don't want to lose my benefits, you can let them know they have this trial work period of 9 months during which they can work and earn as much as they want, and they're not going to lose their benefits. Again, I always advise everyone, consult Social Security, make sure the records at Social Security have support that, because sometimes people forget. They might have forgotten they did that odd job a year or so ago, which they earned a bit of money that may have counted towards their trial work period. So it's always good to trust but verify, as they say. But in principle, people should know that they have 9 months of trial work activity, arguably much longer than that. So people ask, what happens after that 9 months is over? Does that mean I now lose my benefits? Well, not necessarily. There's some more good news here, again, if you're an SSDI beneficiary. SSDI offers what's known as the extended period of eligibility that begins as soon as that trial work period ends. Now again, when that trial work period ends depends on the facts of the case. For some individuals, that period might end 9 months after they start working if they're consistently working and earning above that 940 threshold. For other individuals, it could unfold over many years if their work is on and off, intermittent, if their wages fluctuate. But once they've amassed those 9 months of trial work activity during that rolling 16-month period, they immediately enter what's known as the extended period of eligibility. The extended period of eligibility is a 36-month, a 3-year period during which people will continue to receive their full SSDI benefit payment as long as they're not working or as long as their earnings do not exceed the SGA threshold. Does anyone remember what that substantial gainful activity threshold is? So I know, and this is where it gets confusing. 940 is the amount that is used to determine whether someone is engaging in what's defined as trial work. There's another figure which we touched on earlier, and we'll repeat it again, that's used to define substantial work activity. I'm sorry? 1310, you got it, exactly. So 1310 is the amount that Social Security is currently using in 2021 to define substantial work activity. So that's not unique to the trial work period. That cuts across the board for SSI, for SSD. If in 2021 you are working and able to earn more than $13.10 per month, you are considered to be engaging in substantial work activity. So that is important to determining when someone is eligible for Social Security, disability, or SSI. It becomes relevant again once an individual enters the extended period of eligibility. So again, once an SSDI beneficiary has expended 9 months of trial work activity and then enters the EPE, then that full SSDI benefit will continue to be paid for that 3-year period, as long as that individual is not working or as long as the earnings are below substantial gainful activity threshold. However, for any month in which the earnings go above the SGA threshold, the SSDI benefit won't be paid. So I'll give you another concrete example. Going back to myself, in this case, I'm the individual who's in recovery from a diagnosis of schizophrenia. I'm working again, doing some plumbing work, and let's say I've gone through my trial work period. That is, I've completed 9 months of trial work activity, and throughout those 9 months, my monthly earnings have fluctuated, but they've all been above that 940 threshold I referenced earlier. Now I've entered what's known as the extended period of eligibility. And let's say the first month of extended eligibility, I'm not working. I decided to take a break from work because I'm experiencing some stress, perhaps a minor relapse or recurrence of symptoms, so I decide not to work. Okay, so for that first month of extended eligibility, I receive my full SSDI benefit, which in this example is $1,000. Let's say the next month, I go back to work, and that month I earn $1,000. Okay, I'm working kind of part-time at a moderate level. I'm still going to receive my full SSDI benefit because my earnings are below the SGA threshold, which again is $13.10 in the year 2021. Let's say the third month of extended eligibility, I get a bump in hours. My supervisor's impressed with my work, I'm feeling better. I earn $1,500 a month, that month. That means I've exceeded the SGA threshold, so the following month, I will not receive my SSDI benefit. Now you think, oh, how catastrophic, the individual loses his SSDI benefit. I lose my SSDI benefit in that case. Well, that's true for that month, but that only applies for that month during this extended period of eligibility. Let's say that month, during which I don't receive my SSDI, I stop working or my hours decrease, and I go back to earning $1,000, down from $1,500. Then, the following month, my SSDI is reinstated. I receive my check again. So throughout the 36-month period of the extended period of eligibility, any number of things might happen. The individual might continue to receive his full SSDI benefit, might not receive any SSDI benefit if there are wages and the wages are consistently above the SGA threshold, or the benefit payments might be intermittent if the wages fluctuate above and below that threshold. And I realize that can be potentially destabilizing, but if the individual has this information and can plan accordingly, that can help to offset any destabilizing effect. The individual might make a conscious decision, you know what, I'm going to work a little bit less to ensure ongoing receipt of my benefit, or I feel like I can work at a more robust level. I'd rather, have the full-time work activity and accept a minor loss in benefits, or perhaps I'll accept the fact that my wages fluctuate and my benefits fluctuate. I'm going to plan accordingly. As long as you and they have this information, they can engage in some proactive planning. And this goes on for 3 years. Yep. Yeah, question.
I just have a question. What about when a particular person fluctuates through the eligibility system? Like, for example, they start out with SSDI, but then they wind up with SSI, and then they get survivor's benefits, and then it goes back to a different category.
Okay, very good question. After this, we're going to get to SSI, and then after we get to SSI, we're going to tie in the two together, and I think that will answer your question. Yeah, that's a very good question, because it really does vary, but in order to answer that question, we have to get into the SSI work incentive, which we're going to do right after this, and I think you'll have a good idea of how that works. And if not, then, we'll revisit the question, because that's a good point. Some of this does vary based on the benefit package that you receive. So right now, this applies to SSDI beneficiaries only, exactly. So once again, throughout that 36-month period of the extended period of eligibility, that benefit payment will apply for any month in which there are no earnings or the earnings do not exceed that SGA threshold. So what happens after that 36-month period? So let's revisit the chronology. After an individual is deemed eligible for SSDI, there's at least 9 months of trial work activity. It could be longer depending on the circumstances. And then after that period elapses, there's at least 3 years, 36 months of extended eligibility. What happens after that elapses? Does an individual automatically lose benefits? Well, more good news. No. Loss of benefits is not automatic at that point. At the conclusion of the extended period of eligibility, the beneficiary may continue to receive the SSDI if there's no work or if the earnings are below that SGA threshold, whatever that happens to be at that time. Again, it's currently $13.10. It'll be a little bit more next year, a little bit more the year after that. And that's much as it is during the EPE. However, after the EPE concludes, if at any point after that period the individual engages in substantial work activity, then Social Security might stop the benefit permanently, close the case. I say might because it doesn't invariably mean it's going to happen. And again, I go back to my disclaimer at the beginning. You have to look at everything on a case-by-case basis, and I'm going into, some detail here, but there's innumerable other details that can have some impact on whether someone's work activity qualifies as substantial. We're not getting into things like impairment-related work activities or impairment-related work exclusions or employer subsidies. There's other things that can offset some of this, and it's beyond the scope of the training to get into all of that. So one thing I want to caution you is just that. Bear in mind that there could always be some additional detail that could have some bearing on this. What I want you to leave with is a high-level understanding of how some of this works and the ability to reassure your clients that in most cases they'll be in good stead if they follow these rules, but it's always good to consult a Social Security representative or a trained SSI or SSDI representative in making these determinations. So that's my disclaimer for the moment. But following the completion of the EPE, the beneficiaries who don't engage in substantial gainful activity may continue to receive their benefits for a long period of time. But at any point in time, if they engage in substantial work activity, then Social Security is within their rights in most cases to say, we're no longer giving you benefits. We're closing your case. Now, does that mean they can never get them again? No. There's a provision known as expedited reinstatement of benefits that allows people to get their benefits back under certain circumstances. If they have a recurrence of a disabling condition, or if they experience another type of disabling condition, they can certainly reapply. So there's almost always an exception. But in many cases, this is what will happen. If an SSDI beneficiary has been through this process, which has built in a lot of safeguards, at minimum 9 months of trial work activity, minimum 36 months of extended eligibility, and then some ongoing eligibility after that, contingent on wage activity. Ultimately, this may happen, but you can give your client some assurance up front that this doesn't happen immediately, especially if you're talking to someone who's going back to work for the first time after having been deemed disabled. They've got many years to look at before they have to face the prospect of losing their benefit. So that's some good news for SSDI beneficiaries. Not a whole lot of good news when it comes to governmental benefits, but there's a little bit of good news here. So that's SSDI in a nutshell. And I know it's a lot of information, but believe it or not, that is a nutshell because, again, this gets inherently complex. So I've given you a high-level overview of how Social Security treats work activity for SSDI beneficiaries. How does it work for SSI recipients? It's very different. Unfortunately, the news isn't as good here. It's not horrible. I guess it all depends on your perspective, but it's not as good. You may recall from a few moments ago that if you receive SSDI, you're allotted a trial work period during which you can work and earn as much as you want without putting your benefits in any jeopardy. Unfortunately, SSI recipients aren't granted that luxury. As soon as an SSI recipient goes back to work, benefit payments are likely to be reduced. There's a minor allotment or exclusion Social Security will grant. So the first $85 of monthly income, which is nothing, right, $85 a month, the first $85 of monthly income that an SSI recipient receives won't be counted. That is, let's say someone has receiving a stipend, working an hour a week or 2 hours a week and earns less than $85 a month. That's not going to result in any change in an SSI benefit, but anyone who's working is going to be earning at least more than that. For every $2 above that $85 that's earned, $1 will be deducted from the SSI benefit. Another way of saying is that all the money that's earned above that $85 threshold, half will be deducted from the SSI benefit. So I'll just give you a concrete example. I'll use myself again. I was diagnosed with schizophrenia a number of years ago. I didn't work at all. I'm doing better now. I'm stable. I'm going to try my hand at work, but it's going to be very limited part-time. I go back and I'm working a few hours a week in the local grocery store, and let's say I'm taking home $250 a month. Not a lot. We're talking about, $50 a week, $60, $70 a week, $250 a month, and I'm an SSI recipient only. So in this example, we'll say $250 is my gross monthly wage. The first $85 of that is not counted. So what's $250 minus 85? If it weren't Friday morning, I'd be able to do math. Who am I kidding? I can't do math any day of the week. Yep. Does anyone have that handy? 165, thank you. So 165, it's what's left after we deduct 85 from 250. What's half of 165? That I can do. That's 8250, right? Thank you. I don't trust myself. I think so. So 8250 in this example would be considered the countable wage. So again, what does that mean? If I'm an SSI recipient, and let's say I'm receiving $700, $800 a month, you might recall if you were paying attention, and you'd have to be paying very, very careful attention because I know you're being bombarded with a lot of information today, but one of Chris's slides revealed the current monthly federal benefit allotment for SSI recipients. That too can vary based on someone's household composition and other factors, but I believe he said it's $740 some odd, it's going up to $840 next year. In any event, let's say I'm an SSI recipient and I'm getting $800 a month right now. And I go back to work and I start earning $250 a month. Based on the math we just did, we determined that the first $85 of that $250 in gross wages isn't counted. That leaves us with $165. Then half of that, $8250, is not counted. The remainder, $8250, is counted. That means $8250 out of that $250 is my countable wage. That's the amount that is deducted from my SSI. So if I'm receiving $800 in SSI, I go back to work, and now I'm earning $250 a month. My SSI is going to be reduced from 80 to 800 to whatever 800 minus 8250 is, 700 and change. So the good news here is that the SSI recipient in this case is still keeping much of what he or she earns, doing better by working than by not working. So that's often how I present it when I've had that discussion or do have that discussion with SSI recipients. Many will say, with lament, oh, as soon as I go back to work, I'm going to start losing my benefits. Yes, that's true, but you're going to have more money in your pocket working than not working, right? Because in this example, without work, the SSI recipient receives a monthly benefit of $800. With work, that SSI recipient is getting $700 and change, a little over $700, which is less than the $800, plus $250 in wages. Okay? So when you look at it that way, it's not a horrible proposition. Yes, there's an immediate change, but it's still meant to be an incentive for SSI recipients to work. But it's very important to understand this distinction between SSI and SSDI with respect to work activity, because again, you work with many individuals who receive one or both, and they talk to each other, and they may receive one or both, and it's important for them to understand that their experience is their experience, and they have to take account of what benefit they receive in order to determine what's going to be applied to them. I guess the other good news about it is it's a little bit simpler than SSDI, because with SSDI there's different phases. It's tied to chronological events. You have a trial work period, you have an extended period of eligibility, you have a period of post-eligibility. With SSI, this is essentially all you need to know. As soon as you go back to work, this formula applies in determining what your monthly benefit is. And then the amount of your benefit is going to fluctuate based on the work activity. That's another distinction between SSI and SSDI. SSDI is an all or nothing proposition. During the trial work period, you receive your full SSDI benefit irrespective of your work activity. During the extended period of eligibility, you will receive your full SSDI benefit or no SSDI benefit at all based on your work activity and its fluctuation above and below that substantial gainful activity threshold. Following the completion of the extended period of eligibility, you will continue to receive your full SSDI benefit, or you will stop receiving it altogether if you exceed that threshold. So with SSDI, you get your full benefit check or no benefit check. The amount never fluctuates. With SSI, the amount continues to fluctuate, which in one way makes sense when you consider what SSI means, supplemental security income. It's meant to supplement other sources of income. So as that income varies, the SSI payment varies. Again, without getting into the weeds of the formula and all of that, does it make sense on a certain level how this works? I'm not asking you if it's logical. It's not logical, I know that. I mean, this is all a product of, sausage making at the governmental level, but hopefully it makes at least some conceptual sense now, enough so that you can explain it to your clients or help to answer general questions they have. I'm sorry. Yeah.
That's good, just to have the basic knowledge.
Yes.
Explaining to them, it's not that you're losing anything, instead you can gain some more.
Exactly. Exactly, absolutely, yeah. And again, that's what we hope to send you away with today, is a high-level knowledge, a frame of reference so you can begin to explain certain things to your clients in a way that you might not have before. Also with the caveat that, they need to verify, you need to help them to verify. Obviously you would never say to your client, I've never said to a client, take my word for it, you can go back to work and this is what's going to happen, or this is not what's going to happen. There can always be some other detail of which we're unaware that could have some bearing on this because it's so inherently complex. So we always have to be careful, and we have to qualify that for our clients and let them know that, look, we're going to give you general advice and guidance, but we have to verify this with the appropriate authorities. But this is what you should know, and these are how the rules work, and just having that information can give them some reassurance. And yes, there is good news here. Again, as with all news, it depends on your perspective. You could look at it, through a positive lens or a negative lens, but I think there is some good news associated with this as well. So that's the SSI work incentive. Before, Desh, how are we doing on time? Okay, very good. Moving along. All right, so we will allot some time at the end for questions. I just want to make sure I don't keep you too long. I'm sure you don't want to spend all your Friday here. Or maybe you do. I don't know what else you have planned today. So I could keep you here till New Year's talking about benefits if you want. But Medicaid, again, right? We could be here till New Year's talking about Medicaid. I mean, we know what a big program Medicaid is, and it seems to get bigger and bigger. Needless to say, can't give you anything more than a primer on Medicaid, and I imagine many of you know a bit about Medicaid. Medicaid, again, is a very comprehensive health insurance program. By comprehensive, it's another word for thorough, meaning it covers a lot of different programs and services. Now, Medicaid, many people will say Medicaid's great, many people say Medicaid sucks. I would say both are true, okay? Medicaid's great, and that it covers more categories of service and supports and medical supplies, and the list goes on ad infinitum than just about anything else. But there's a lot of drawbacks to Medicaid, and I think probably most of you know what they are. Medicaid is only available to people who meet stringent income requirements, not as stringent as they used to be. There have been certain advances, especially under the Affordable Care Act and other recent initiatives that have expanded Medicaid eligibility to classes of individuals who were previously excluded, but still not an easy benefit to get. So you have to have generally limited income or qualify in accordance with the disability to get that benefit. So it's not the easiest thing to get. And also there are some of the drawbacks to Medicaid. Medicaid generally does not pay providers very much, so many providers don't want to accept a Medicaid benefit. So oftentimes, even if you receive Medicaid coverage, you might have difficulty finding a provider who will accept it. It's not as much of a problem in this part of the country, or at least in this part of New York State. We live in Westchester, which is a pretty service-enriched environment, despite all the drawbacks of Westchester and the cost of living and so forth. There are a lot of providers here and a lot who are willing to accept Medicaid. So generally, people don't have a hard time finding Medicaid providers in Westchester when it comes to most services. That's not true in other parts of New York State, and definitely not true in much of the country. There's parts of the country where you can have a Medicaid card and it's not worth the plastic it's printed on because the closest provider who accepts it is 300 miles away. So there's drawbacks to Medicaid, to be sure. It doesn't cover everything, and not all providers accept it, and it's not always the easiest thing to get. However, for those individuals who do have it, it does provide a safety net form of coverage that is fairly comprehensive in nature. It includes everything from, pharmaceuticals to durable medical equipment to, you name it, medical transportation. There's restrictions, terms and conditions apply, as they always say, as much to Medicaid as to anything else. And Medicaid continues to evolve and change like everything else. When I started in this field, if you had Medicaid, you took your Medicaid card, you went to see anybody you wanted to see, they would accept it, send in a bill, it got paid, you were all well and good. It was pretty easy to use and navigate. More and more of the Medicaid benefit has been funneled into what are called managed care organizations. Imagine many of you know that, have heard of that. Managed care organizations are basically private insurance companies, intermediaries that stand between the State Department of Health, the main administrator of the Medicaid program, and the providers and the recipients. What is the job of the managed care organization? The job of the managed care organization is to cut costs, right? It's to manage care. By managed care, they mean limit care. That's what the job of the managed care. That's what the job of the managed care company is. They'll tell you their job is to focus on quality of care, and I suppose they do some of that some of the time. But the reason why the states, New York State and other states, enlist managed care organizations is to contain Medicaid costs. Full stop. That's the reason. So you all need to understand that. Managed care organization's job is to limit Medicaid expenses for the state or the federal government. That's another important point, too. Medicaid expenses are shared by the state and federal government. In New York State, it's mostly a 50-50 split. In other states, it could vary based on other factors. Generally speaking, rural states, states that don't have as much of a tax base, pay less into it. The federal government picks up a larger share. In New York State, it's roughly a 50-50 split. But the managed care organizations were established or were entrusted with these Medicaid dollars in order to limit expenses. So what does that mean for your clients? Well, now many of your clients have more than one Medicaid card. They might have what's known as a common benefits identification card, that blue and white card, which is their Medicaid card used for certain services that might be paid by Medicaid directly. Many of them also have a card that might bear the stamp or signature or print of a managed care organization. And these are major insurance companies. Some of you might subscribe to them as well, or you might have a commercial plan sponsored by your employer. Affinity, United Health Group, GHP, Fidelis, the list goes on and on and on. These are all common household names. Many of them are Blue Cross Blue Shield. And you might have grown up hearing of them and thinking, geez, are Medicaid managed care organizations? Well, they weren't always, and they're not exclusively now. Insurance companies have many what they call books of business. They have commercial lines of business with which they contract for which they contract with employers to provide coverage for employees. Increasingly, they have Medicaid lines of business as well. What is a Medicaid line of business? It's simply a contract between the managed care organization and the state or federal government to provide a benefit to insured individuals, but they act as the gatekeeper. They limit insurance, or they limit certain deliverables based on the terms of the contract, much as they do for our private insurance. So many of you might have to go to a primary care physician, or have to get a prior authorization or pre-approval for certain services that you receive. The same applies for many Medicaid recipients now, too. So I'm not saying this is all good or all bad, but a lot of what's been happening with Medicaid is designed to curtail costs. So again, it's a complex program. It has many pros and many cons associated with it. One thing Chris mentioned, a critical point that bears repeating, is this. In New York State, and in most states, 35 out of the 50 states, having SSI means you automatically qualify for Medicaid. You automatically get it. Now, one of the questions that was posed earlier was about there being a disconnect. So someone may qualify for SSI and for whatever reason not have Medicaid. That's simply because the system isn't working properly. Imagine that, the system not working properly, right? Never heard of that. And I think that was one of the questions that someone posed to Chris, well, what do you do in that instance? Again, every case is different, but I've come across this in my career. If someone has been approved for SSI in New York State and the Medicaid case has not been opened, then what I typically advise them to do is to bring or provide proof of their SSI eligibility to their local Department of Social Services office, and then the Medicaid case should be open. Oftentimes there's a time lag, so if someone is newly eligible for SSI, their Medicaid case might not have been opened. Sometimes that delay can be extended. I can't imagine what's happened during the pandemic. I'm not as close to the individual cases as I used to be in my administrative role, but I've heard stories of it. Maybe you've experienced this. But suffice it to say, if someone lives in New York State, receives SSI, that individual is by rights eligible for Medicaid. Maybe there's some proactive work that an individual needs to do to activate the case, but that should happen automatically. Doesn't mean you have to receive SSI to get Medicaid. I want to be clear about that. Again, Medicaid is a benefit, much like DSS benefits, that are open to a broad category of individuals. It could be individuals who are disabled, individuals who are non-disabled, individuals who qualify based on income. Again, initiatives under the Affordable Care Act, and even more recently, especially under some of the federal packages that have been enacted during the pandemic, have made Medicaid more available to larger classes of individuals. So you don't have to have SSI to qualify for Medicaid, but if you do have SSI, you automatically qualify for it without question. So that's an important point I should make. So I think that, at a high level, covers Medicaid. This is not something you're going to encounter often, but figured it's worth mentioning. There's a rare provision built into Social Security law which governs Medicaid that allows SSI recipients who lose their cash benefits due to income to retain their Medicaid eligibility even with substantial income. That current threshold is $54,000. So what does this mean in practical terms? Again, if you recall how the SSI Work Incentive Program works, the first $85 of an SSI recipient's wages are excluded from consideration, then half of the balance is excluded. Well, based on that logic, as the SSI benefit, well, as the wages increase, the SSI benefit decreases, right? So if someone's wages continue to increase, let's say they receive wage increases, they work more hours, their wages continue to increase, eventually that SSI benefit's going to go down to zero. That's what's known as the break-even point. It doesn't happen for all SSI recipients. Some of them may not work to that point or work long enough, but from some it does. It might get to a point where they continue to work and earn more and more, and eventually their SSI benefit gets reduced to zero after that formula is applied. That doesn't mean they lose their Medicaid eligibility, because I said earlier, Chris said this, I'm repeating it, having SSI means you automatically qualify for Medicaid. One might think that you would then lose your Medicaid eligibility once your SSI cash benefit is reduced to zero, if it's reduced to zero due to work activity. Now, there's a special provision built into the law that allows SSI recipients to retain their Medicaid eligibility even if their cash benefit is reduced to zero, as long as their annual earnings are below this threshold, $54,000, which is, certainly not a fortune in Westchester given the rents, but not an insubstantial amount. So suffice it to say, SSI recipients who go back to work and lose their cash benefits in all likelihood are going to retain their Medicaid eligibility. That has a good protection built into it. Medicare. You might recall Chris saying earlier that SSI is tied to Medicaid, SSDI is tied to Medicare. That's essentially true. Again, there's always exceptions. There are some rare instances in which people can qualify for Medicare without having SSDI. For instance, people who are in end-stage renal disease can get Medicare even if they don't have SSDI. That's a special provision that was built into Social Security law for a whole host of bizarre reasons. There's always exceptions to every rule when it comes to this, but generally speaking, in the vast majority of cases, individuals who have Medicare because they're receiving either SSDI or they've reached retirement age. And again, Social Security offers a variety of benefits. We're focusing largely on SSDI and SSI, but there's what's known as old age, survivors, retirement benefits. Medicare comes with that too. So most people in this country who receive Medicare for the same reason they receive Social Security. They've reached their retirement age. But you needn't reach retirement age to qualify for Medicare. If you have a disabling condition and you qualify for SSDI, and you received SSDI for at least 24 months, you have to have been, let me rephrase that. You've been eligible for SSDI for at least 24 months. Sometimes people receive approval for benefits long after they were deemed eligible, and Chris talked about that a little bit earlier. But if you've been eligible for SSDI for at least 2 years, you then qualify for Medicare. And again, individuals age 65 years or older are generally eligible to receive Medicare in conjunction with Social Security retirement. So what is Medicare? How is it different from Medicaid? Medicare is not as, in some ways, Medicare is not as generous as Medicaid. Again, using air quotes, because whether Medicaid is generous is debatable, but it does cover a broad category of services. Medicare generally doesn't cover as much as Medicaid does, at least by way of category of service. Now, it may pay more. That is, it might pay providers more. So a provider who accepts both benefits might receive more in reimbursement from Medicare than he or she does from Medicaid, but Medicare might not cover as much. So there's certain categories of healthcare service that are covered by Medicaid that aren't covered by Medicare. I'll give you a cardinal example, which is near and dear to my heart, my services. Not my personally. I don't provide service personally anymore. Many days I wish I did. But my agency provides Office of Mental Health licensed Medicaid reimbursable supportive housing. Medicaid covers that service. So individuals who are living in some of my agency's housing programs receive services from the staff that are reimbursed by Medicaid. Medicare doesn't pay for that. Private insurance doesn't pay for that. There's no other insurance right now that pays for the services my agency provides but Medicaid. There's some talk about that service being folded into managed care, but even that hasn't happened yet. So the services that, most of the services that my agency provides, the lion's share of the services that my agency provides are paid by Medicaid. Medicare doesn't cover them. So if someone comes and is otherwise eligible for my agency services but doesn't have Medicaid and only has Medicare, we can't serve them, unfortunately. I mean, we can try to help them get Medicaid, but until they do, we can't get paid for serving them. So Medicare covers a lot of things, but not as much as Medicaid does. And there's also more cost sharing built into Medicare. Now, what is cost sharing? Cost sharing is a broad, well, it's a phrase that refers to a broad umbrella that can include many different things. You all have, I imagine you all have cost sharing with your health insurance. Cost sharing can be a deductible, the amount that you have to pay towards your medical expenses before insurance kicks in. It can be a point of service copay. If you go and pick up a prescription at the pharmacy, you might have to pay $2 or $5 or $30. It could be a premium. Most of you, I imagine, are paying some kind of premium. Maybe it's being deducted from your paycheck. You have to pay a certain amount towards your health insurance. That's what's known as co-insurance. Or cost sharing. Medicare often includes cost sharing because Medicare is not just given to individuals who qualify in accordance with income standards. There's some very wealthy people who get Medicare. You know, if you receive SSDI, you could actually be wealthy. And you might be saying for a moment, scratching your head, how can that be? If you think back to how I defined the benefit eligibility program earlier, I explained that Social Security Disability Insurance works much like an insurance program. If you've worked and paid into the trust fund and then you become disabled because you are unable to work and you're unable to return to substantial work activity, but you managed to save $1 million in the bank while you were working, you can get Medicare and you can get Social Security Disability Insurance. You can't necessarily get Medicaid or SSI, but you can get SSDI and Medicare. And there are a lot of wealthy retired people. There are a lot of poor retired people too, of course, but there are a lot of wealthy retired people who collect Medicare. Medicare and SSDI and Social Security retirement are not indexed to wealth or income necessarily in the way that SSI and Medicaid is. But for that reason too, Medicare often imposes a lot of cost sharing. So there's an expectation that if you receive Medicare, you may be able to afford co-payments, deductibles, co-insurance, things like that. And that's why there's a lot of gaps in Medicare coverage, because there's a presumption that you have some other resources, you might have some other resources. Medicare is broken into different parts. Part A is part of Medicare that generally covers services rendered in an inpatient setting. Part B includes a lot of services that are rendered in an outpatient setting, to put it quite simply. There's a lot more to it, but suffice to say that's the distinction. And I say that because if you're working with anyone or you know anyone who has a Medicare card, you'll see it typically will include Part A and Part B on it, or Part A and Part B eligibility dates, and you'll wonder what are Parts A and Part B. That's what Part A and Part B is. Part A is typically automatically given to eligible individuals. Part B is given to individuals who qualify, again, those who have SSDI or have been eligible for at least 2 years or qualify by other means, but they have to pay typically a monthly premium for it. That monthly premium can be pretty hefty. It's over $100 now. In many cases, that's automatically deducted from a Social Security check if that's available, and if not, then oftentimes people have to pay for it. Medicare Part D is about 15, 16 years old now. Didn't exist before 2006, I want to say. Medicare used to not provide prescription drug coverage at all. And back shortly after the turn of the century, there was a lot of clamoring for Medicare to start picking up the cost of prescription drugs since it's such an expensive component of treatment. So in or around 2006, Part D coverage was added, which provides prescription drug coverage. And there's now talk in Congress about adding other benefits to Medicare that didn't exist previously, like some vision benefits, some hearing benefits, other things that many seniors and people with disabilities need that are not traditionally covered by Medicare. So there may be a new part coming to a theater near you. You'll wonder why I skipped a letter of the alphabet, Part C. Part C typically refers to what are known as Medicare Advantage programs that are private insurance programs that operate in partnership with Medicare that provide supplemental benefits. I don't mention them because we don't work with many individuals least in our line of work, that are actively participating with that. We have some. It's mostly seniors who are receiving Medicare Advantage plans or participating in that, but as with all things, I can happily get you more information about that should it be necessary, but try to tailor this to the needs of the individuals we serve and to make it most relevant for you. So in the work that you do, you're most apt to encounter Medicare Parts A, B, and Part D. And again, some individuals may have Medicare and SSDI alone, and Medicare may be solely or primarily responsible for covering their treatment. Some individuals might have SSDI and SSI and Medicare and Medicaid. And what happens if someone has Medicare and Medicaid? Or Medicare and Medicaid and some, let's say commercial coverage through an employer? You might have heard the phrase primary, secondary, or even what's known as tertiary coverage, which typically means if you have more than two. So if individuals have more than one form of coverage, that's fine if they meet the eligibility criteria for each of them. But then the providers have to bill in a certain order, and each insurance stands in a different position with respect to its fiscal responsibility. Medicaid, by federal and state law, is the payer of last resort. So if someone who has Medicaid has other forms of insurance, Medicare or commercial insurance, that payer has to pay first if it's a service that is covered by that insurer. So I'll use, again, my agency as an example. We have many people in my agency, living in my agency, who have both Medicare and Medicaid. You might remember me saying earlier, Medicare doesn't pay for our services. If Medicare did pay for our services, Medicare would have to pay first whatever its portion is. And if there's a portion that is unreimbursed by Medicare that's left over, if you will, then Medicaid would be responsible for paying it. In the case of my services, Medicare doesn't cover it. By law, Medicare can't cover it, so Medicaid pays the full amount for which Medicare has agreed to pay. I'm sorry, Medicaid pays the full amount for which Medicaid has agreed to pay. But this is going to vary from service to service. So what you always have to advise your clients is this. If you have 1, 2, 3, 5 forms of coverage, bring all your cards, your whole wallet full or pocketbook full of cards to your healthcare provider, their billing office, let them know. Their billing department's going to know what needs to be done with it, because they may not always know, and it doesn't always operate in the way that you think it's going to. Again, oftentimes Medicare will be the primary, Medicaid may be the secondary, the commercial provider might be the tertiary if it exists. It doesn't always work that way. Again, terms and conditions apply, and it's beyond the scope of this training or even my knowledge to tell you. Because it does get to be quite complex. But suffice to say, you can have more than one form of insurance coverage, but they're not going to operate equally. Some other good news here, and this is another thing I should really leave you with, which is good because we're just about done. One big question that many people have, many recipients have about their benefits is this. It's at least come to me many times, maybe will come to you or has come to you. Many may say to you, okay, you know what, I don't want to go back to work because I'm worried about losing my cash benefits, and I can't afford to lose my health insurance because that's my lifeline. Well, up until now, we've been talking a lot about how individuals can preserve their cash benefits through SSI or SSDI even while working. They can also preserve their Medicaid while working, and we talked about that in the example of the individual who was receiving SSI and goes back to work and has their cash benefit reduced to zero. There's similarly good news applies to Medicare beneficiaries. SSDI beneficiaries who go back to work, who go through a trial work period, who go through extended period of eligibility, who then enter a period of post-extended eligibility and then lose their cash benefit, will, in most instances, continue to receive Medicare, in some cases up to several years. So all the protections, and I'm talking in general terms because there's always exceptions, but all the protections that I've described that pertain to cash benefits extend to and or are enhanced for health insurance benefits. So in most cases, individuals will not put their health insurance benefits in jeopardy if they go back to work. And I'll say that's as true now as ever, and a big part of that is through recent acts of Congress. Again, the Affordable Care Act, enacted the Patient Protection and Affordable Care Act, enacted under President Obama, expanded a lot of protections for this, but recent acts by Congress, especially during the COVID pandemic, had added protections to that. So not saying it's easy to get benefits, not saying they can't be lost, they certainly can, to be sure, but there are many more protections built into the system now for individuals who qualify for these benefits than was the case, certainly when I started out in the field, but even 10 years ago. So there's some good news as far as that goes. Chris left you with some additional resources. I'm going to say on that note too, I have handouts that are printed by the Community Services Society of New York. It's a agency based in the 5 boroughs. I don't know if any of you have ever worked with them. They have what's known as the Benefits Plus Resource Center, I believe it's called. Through all my travels, and I've been around a bit, It's one of the most comprehensive databases I've encountered for all things benefits and entitlements, and I printed out a roster of their resources, and it's broken down by state, federal, county, local resources, and every topic that I touched upon, every topic that Chris touched upon, and many, many, many more are covered in this handout. Now, the handout doesn't include a lot of information. What it includes are basic links or directions for accessing additional information. But if you take what I give you and just Google it, you'll get to where you need. I made not enough copies for everyone. I wasn't sure what kind of turnout we'd have. I'm also trying to be somewhat circumspect in how I print out things nowadays, because I know handouts tend to languish in the circular file around desks, and trying to be more mindful of my carbon footprint and not hasten the Earth's demise any more than I already have. So I'm trying to take all that into account. That's what I think about on a Friday morning. But I have 20 copies, 25 copies. I imagine some of you are coming from the same organization, so if you are, perhaps you can share. But if there isn't enough for everyone, happy to make additional copies, and I can get them to you through Desher or colleagues. But here's some additional resources too. So hopefully between all of this and the PowerPoint slides, you'll have what you need. And with that, I think we have some time for questions. Do we? Desh, what's the time?
11:36.
Very good, and we'll even get you out of here a little bit early. Yes, questions?
I haven't heard any that you touched on the spend down part.
Spend down, Medicaid spend down. Very good. Okay, let's talk about a Medicaid spend down. So what's a Medicaid spend down? So Medicaid, we talked a lot about individuals who receive SSI and Medicaid. If you receive SSI, you're automatically eligible for Medicaid, and you don't have to pay anything for your Medicaid. So there's a certain class of individuals who qualify for Medicaid free of charge. That doesn't include everyone. So, I'm sorry, your name? Digna? So Digna posed a good question about something called a spend down. Can I raise your hand if you've heard of Medicaid spend down? Oh, okay, good. Just about everybody. Okay, so what is a Medicaid spend down for anyone who might know? Or even if you've heard of it, maybe you don't know. So Medicaid sometimes can include cost sharing. So not everyone who qualifies for Medicaid qualifies for it free of charge. Medicaid does have income limits tied to it. So if you are an individual who has a disabling condition, but your income is above a certain threshold, okay, and let's say you don't qualify for SSI. Let's say you qualify for SSDI, but your income might be above a certain threshold because you might be receiving SSDI and you might have wages, or your SSDI might be above a certain threshold because you've worked quite a bit prior to the onset of your disability and paid a lot of taxes into the Federal Social Security Trust Fund that allows you to claim a higher benefit, because you might recall the amount of benefit that you get is roughly commensurate with your earnings history. You might be above that threshold that's set by Medicaid for eligibility. But nevertheless, you have a disability, you have a medical need for Medicaid. In that case, the Department of Social Services will allow you to have Medicaid provided you pay what's known as the spend down. The spend down basically is paying the difference between what your monthly income is and what that eligibility threshold is, the federal benefit rate, which in some cases can be quite substantial. So for some individuals, if they receive, $2,000 a month in SSDI, and some people do, but they need Medicaid and they don't qualify for SSI, they might have to pay $1,000 a month to get their Medicaid. Now, there are workarounds for that, and we could spend a month talking about that, but I'll just give you a couple of examples. There's a program known as the Medicaid Buy-in Program for working people with disabilities. It's a program that actually allows people who receive SSDI and who are employed actually to qualify for Medicaid under much more generous income guidelines. So in some instances, people who have SSDI and are working can qualify for Medicaid without having to pay that spend down, even if their income is significantly above the threshold. However, ironically, if an SSDI beneficiary isn't working but has income that's above the threshold, that spend down might apply. So there's a lot about the system that is not always logical, and part of the reason that is sometimes different initiatives or incentives are put into effect to address a particular problem without taking account of a larger problem. So you're going to see a lot of inconsistencies in the system if you haven't already. But getting back to Digna's question, what is the spend down? The spend down is simply the difference, roughly, minus some exclusions, between someone's monthly income, whatever that happens to be, and what the Medicaid eligibility threshold is, which means that's the amount they have to pay back to DSS in order for the Medicaid to be considered active. We talked a moment ago about what a deductible is. And I think we all probably know, or most of us know, what a deductible is in different forms. You might have an automobile insurance deductible, which means that if you get into an accident, You might have to pay the first $500 of the repair bill before insurance picks up the rest. That's essentially what a spend down is. So you'll have to pay a certain amount towards your health insurance costs each month before Medicaid kicks in. Now, in some instances, I know DSS has allowed you to actually pay that towards your medical expenses, keep the receipts, submit the receipts. More commonly and more simply, you just send that amount to DSS, they process receipt of it, and then they activate your Medicaid for that month. There are, again, workarounds. Individuals who are receiving SSDI and are working are eligible for the Medicaid buy-in program. Sometimes individuals can set up a trust fund. There's something known as a supplemental needs trust. Supplemental needs trust is a certain mechanism that was set up by Congress that allows people with disabilities to insulate certain funds they have in a set-aside account subject to the jurisdiction of a trustee for which they could be the beneficiary, and the amount in that trust, what's known as the corpus, will be exempt from consideration. I've seen instances in which individuals will establish what are known as self-settled trusts. They will take a certain amount out of their SSD, let's say, put it into that trust fund each month, and that will be counted towards their spend down, but they'll be able to use that money to pay their own expenses. So in essence, they are satisfying Medicaid's requirements, but they're paying themselves at the same time. So that's one example of how people can find kind of creative workarounds of the spend down. So just because someone has an income that exceeds a certain threshold doesn't necessarily mean they're going to be liable for a spend down. There might be some other avenue through which they can avoid it. But you may come across some instances in which clients are asked to pay a certain amount towards their Medicaid each month in order for it to be active. If that happens, it is a good idea to explore some other options with them if they apply to see if they can avoid it, because that can serve as a powerful disincentive for people to claim Medicaid, especially if they're looking at a several $100 a month bill. Sure. Other questions? And again, all this information can be made available to you, and I will leave the handouts here, so feel free to grab some if you want, and if you need more. Yeah, Betty.
I don't think it covers the fact that the Medicare premium can be covered with the QPR.
Thank you. Thank you very much. So Betty raised an interesting point. So I'd mentioned that there's a Medicare premium, not for Part A generally, in some rare instances, but for Part B, which is a part that covers outpatient services, many outpatient services, but not free of charge in most instances. Oftentimes individuals have to pay a monthly premium for that coverage, which I think is going up to $140, if not more, next year. I don't know what it is now. I imagine some of you do. It's up there, which is it's a lot of money each month for anyone to pay, let alone someone who's on a limited or a fixed income. It could be $120, $130, $140 a month that someone has to pay towards their Medicare in order for them to have that Part B coverage. Again, there are exemptions. Somebody who has both Medicaid and Medicare is not going to pay that, because if you receive Medicaid, there's a presumption that you have more limited income and you cannot pay that. However, you might have more income than Medicaid allows, but you might still be in what I'll call a gray area. You may qualify for different programs that will pay that Medicare premium for you, and they go by a whole alphabet soup of acronyms, and there's 2 or 3 or 4 of them that are tiered in accordance with the income threshold, and that's another benefit that's administered by the Department of Social Services that I didn't even get into because that list gets so exhaustive, but it's a very good point. So if someone is receiving Medicare and has to pay a monthly premium, either directly by sending a check into the Social Security Administration or by having it withheld from their Social Security disability or retirement benefit, but their income is nevertheless low, or you have some question about whether it's low enough for them to qualify for that subsidy, you should explore that with them, because there is a benefit program that allows that premium to be paid, in that case, by Department of Social Services. And that's also something you can access, I think, you can either access that through the Department of Social Services, through the My Benefits portal, or in some cases, I think, through the Social Security Administration. Chris mentioned earlier that some of these agencies and organizations work in tandem with each other or in partnership. A good example is Medicare. There are certain elements of Medicare that are administered by the Social Security Administration because it's granted to people who receive SSDI or whose retirement benefits, but then there's elements of it that are administered in part by Department of Social Services, because that program that Betty referenced that reimburses costs associated with Medicare Part B is administered by DSS. So sometimes you are dealing with more than one agency when it comes to this, and that's again where having these resources comes in handy, because of course there's no way I can give you all that information here, but if you look at these resources as it pertains to each benefit program, it will give you essentially a roadmap to getting where you need to be. But that's a very good point too. So, one of the key takeaways here, I think, is this. There's a lot of need. Nothing that we do is try that we might is going to address all that need. That's the bad news. We know that. The good news is there are a lot of resources out there. They're not perfect. You're not going to access all of them. You're not going to access all of them without going through a lot of red tape. You know, there's no question about that. That was as true before the pandemic as it is now, if not more so. But having this information should give you that light at the end of the tunnel that isn't necessarily an oncoming train, that there are a lot of resources. And I'll say especially in New York State, you know, again, like all states, you know, there's the good, the bad, and the ugly. It's expensive to live here, cost of living is high, there's a lot of drawbacks, we know that. But there's also a lot of benefits available to individuals with limited income and disabilities, much more so than in other parts of the country. You know, we also have a big tax liability in New York State, which isn't good, but the upside to that is that there's more of that goes towards the social service infrastructure here than you'll find elsewhere. You know, there's parts of this country where you can't get any of this. I'm not saying it's easy here and it's perfect, far from it. But there is a lot more help to be gotten if you're persistent, if you know how to navigate the process, if you have the right contacts and resources, and ultimately that's to the benefit of the individuals you serve. So that's another key takeaway, and hopefully after you review and digest more of the resources, you'll have a better idea about that. So, you know, before we conclude today, I'll just say this. Once again, thank you for doing what you're doing. It comes at an especially critical time. I hope this wasn't too overwhelming or confusing. Again, it took me years to know what I know, and what I've learned is that there's much more I don't know than what I do know, especially when it comes to this and everything in life. But if you leave today with at least some idea that there are resources to be gotten and there's a means to access them and in turn help your clients, hopefully you'll go into the weekend feeling a little better about your jobs. Any final questions? Thank you again, everyone. Appreciate your time and your attention. Have a great weekend. Keep up the good work.